And you're good. Oh, actually,
You're good. Okay.
Just rub your nose on that dead thing there, it'll be fine.
So how do you want me to ask fracture care? How do we go about that?
Dr. Lager, do you have much experience treating fractures?
Okay. Dr. Lager, do you have much experience treating fractures?
Yes, unfortunately I do, Jeanette. I've been in the ER for about 20 years now, taking care of all types of fractures. From just the trip on the sidewalk, I broke my wrist, to someone who'd fallen from 4 or 5 stories or been run over by a truck. It's awful. It's awful what can happen in the course of a day. And when you're on call in the emergency room, you can see almost everything. So you can say, what are your most common types of fractures?
we'll run through your questions, then we'll run them.
Okay. What are your most common types of fractures?
We use our hands a lot, way more than people think. So I would say that's the number one injury that we see. Fractures of the hands and fingers, people getting caught in car doors, falling, a lot of wrist fractures from falls. I would say that those are the most common ones. Second would probably then be ankle fractures. A lot of people twist their ankle and they just sprain it. Other people twist their ankle, sprain it, and break them. And so I would say those are the top 2 fractures that we see.
So I'm going to run with the ankles now. How would you like me to ask
Sure.
about ankles?
I think I just sprained my ankle. You're going to be the most injured interviewer ever.
Oh my
It's
god.
like, a friend of mine just sprained her
Not
ankle.
that, guys.
A friend of mine just sprained my ankle. What do you normally do for those?
Okay. A friend of mine just sprained her ankle. What do we normally do for those?
We have the patients come in, and a lot of people have a lot of pain and swelling, and they're not able to walk as well as they did before, and all that makes perfect sense. First, you want to make sure that there's no fracture, so x-rays are essential. Physical exam is very important. The most commonly sprained part of your ankle is on the outside part, and that can get very swollen and painful. And so we talk about RICE, rest, ice, compression, elevation. So we'll use an ACE wrap to try to compress the area and set the blood flow back up to the heart. Ice, which is a great anti-inflammatory to try to, sorry, I couldn't even follow RICE. I skipped. Sorry, won't you with your friend?
No problem.
Yeah.
A friend of mine thinks she sprained her ankle.
That's too bad, Jeanette, but we can help her. Ankle sprains are very common, and when someone twists their ankle or falls the wrong way or missteps, it can get swollen and painful, and they're not able to walk the way they could before. First thing we do is we get x-rays to make sure we don't miss a fracture. You don't want to do that. And then we kind of follow RICE, which is a formula for treating ankles: rest, ice, compression, elevation. It all sounds logical, but they're all very important. So the rest part, we talk about some people need crutches, keeping weight off of their ankle. Sometimes we'll give them what's called a cam walker boot, which is like a ski boot that allows them to still put weight on their ankle, but it has a rocker bottom, so it rolls. So it takes the functionality of the ankle away, so instead of using your ankle up and back like we normally do, it allows the ankle to rest. Ice is nature's best anti-inflammatory. Big bag of that 20 times or 10 times a day, depending on how long they can do it, usually for about 20 minutes at a time. Compression is an ACE wrap. We start at the toes, we go all the way up over the ankle. That allows return of blood flow back to the heart. Sometimes when the blood sits around when it's swollen, it can get cramping and achy, and it's just not very helpful for you. Also with elevation, change the pressure gradient so it's above the level of your heart and the swelling will go down. A lot of patients, when we see someone with a bad ankle sprain like that and they do have to go into a boot, they lose what's called proprioception, meaning you lose that feedback. When you put your heel on the ground, even if your eyes are closed, you realize you're putting your heel on the ground. There's a lot of neurologic transmitters that allow you to have proprioception, understand how you're walking, and patients lose that very quickly. So we try to involve functional rehab as soon as we can, with physical therapy, home exercises, sometimes using modalities like ultrasound and stim. All that will try to get someone back to what they were doing before. Typically, an ankle sprain may take about 4 to 6 weeks. Some are worse. There are different grades of sprain. There are also different types of sprains. The more typical one is on the outside part of the ankle, but some go all the way up the leg, in between both the tibia and the fibula, and that's called the desmotic sprain.
Sense.
I want to talk about peds.
Sure.